Apologies, Liz. Item 1.
We've received apologies from Councillor David Hopkins. Shall I just do the roll call?
Yes, if you wish.
Okay. Cyril Anderson.
Present.
Mike Dirk. Joe Hale.
Yeah, sorry, I'm eating. Cheers, I'm here.
Yvonne Jardine. Hazel Morris. Paulette Smith. Gloria Tanner.
Present.
Leslie Walton.
Present.
Chris Hawley.
Present.
Linda James.
Present.
Mary Jones.
Present.
Susan Jones.
Present.
Cheryl Philpott.
Present.
Clive Lloyd.
Yes, yeah.
Andrew Lewis.
Present.
Andrew Stevens.
I think Andrew's given his apologies.
Have you frozen, Liz? I think Liz is frozen. Can I ask you all to mute your
Hello?
mic? Well, here we are. You're back now, Liz.
Sorry, I went then.
Yeah.
Adam Hill.
Present.
Sarah Lackenby.
Yes, I'm here.
Jeff Bacon.
Yep, present.
Adrian Chard.
Yes, present.
Great, thanks very much.
Thank you.
Okay, thank you, Liz. Agenda item 2, disclosures of personal or any prejudicial interests. No. Just a reminder, agenda 3 is prohibition of whip votes and declaration of party whips. Quiet, good. Any public questions, Liz?
No questions submitted.
Okay. Agenda item 5. I'd like to welcome the cabinet members. I know David can't make it today, but Clive, Andrea, and Andrew Stevens, and also like to welcome Adam Hill, Sarah Lackenby, Jeff Bacon, and Adrian Chard. Before we open the agenda item 6, before we open up, is there any opening remarks our cabinet members wish to make? Andrea, yeah.
Thank you, Chair. I will be brief, and I'm grateful to the panel for submitting questions in advance, which is always very helpful. I just wanted to refer to the actual size and detail in the document, which I think just goes to show just how much work has been going on in this area from the start of the pandemic and prior to the pandemic. I think members will appreciate that we were already on the journey in terms of agile working, but that has accelerated and then some during this period. And so, you know, we welcome attending committee today, really appreciate the interest in this particular area, which is, you know, does have a great impact on the workforce. But you will appreciate the amount of work that's gone into it and the amount of time and effort. And my gratitude to all the officers on the call today for all the work that they've done in this particular area. So I'm not going to say any more than that, Chair. I'm not sure if Councillor Lloyd wants to add anything further, but look forward to responding to the questions and any further ones which may be submitted today.
Thank you, Andrea. Clive, would you have anything to say?
No, nothing to add.
Okay. I can't see Andrew Stevens on, so we'll go on to agenda item 5. I take it it's either Sarah or Jeff Bacon presenting this presenting the item. So it's over to you then, Sarah or Jeff.
Well, hopefully Sarah.
Thanks,
She's
Chair.
written-
Yeah, I'll make
she's
a
written
start.
95% of it.
Yeah, I'll make a start, and Jeff and Adrian will probably chip in as well. I know you've read the report, as you've sent some helpful questions in. Chair, would it be helpful if I address the questions which have been sent in, or would you like me to go through the report in detail?
I think the majority of the officers, members, have read the report. And so I wouldn't want to, I just want you to give us the broadest detail, not, don't go through it verbatim, but just the important items. I think the members will be happy with that.
So just to pick up on Councillor Lewis's opening remarks, just about how far we were already before the pandemic on agile working, which I think it did set us in a very good position then when we had to immediately send the majority of staff are working from home. Now, obviously, it's not the same for everyone. It is not one size fits all across the council. So obviously, frontline social services staff or refuse collection, or, there are some services which continued and obviously are front facing. But for the majority of the staff that were desk-based, that could work from home, we were able to very quickly migrate them all to home. Now, there was some contact centres which obviously were office-based. So the main switchboard, for example, things like the common access point in social services, they were usually based in the office. But we very quickly then were able to get that set up at home. We got remote contact centre software set up so that people were able to immediately work from home. So that was a very good and very swift move. As we've said quite a few times previously, but we did a survey in the summer last year as staff had been working at home for a number of months then. And you'll know, but we often do get quite a low response to our general staff survey. But for this particular staff survey about home working, we got an excellent response. And we got some very positive results that those people that were working from home, that they were finding it very helpful. People were saying that they were more productive, that they found it was better for their well-being, that they were able to manage their work-life balance better. And I'll come back to that because I recognise there are also some further supplementary questions from members that you sent through. So I'll come back to that point as well. We have also put in there, as time went on, people weren't necessarily set up at home for home working, in that they might not have had a proper desk or proper chair. So we did bring in new arrangements as well, so that people could buy monitors or a chair or a mouse or a keyboard, so that we could then help them to have a more comfortable home environment. And obviously everybody was doing a risk assessment as well before they were embarking on being at home, so they could assess their whatever workspace they were using at home to make sure that it was compliant. The other thing that's important as well, I think, we talk about digital and, the concern always, whether it's the public or our own staff, what people's skills are like using digital, and that, are we feeling that anybody is struggling or excluded because they don't have the skills? But the thing that the staff survey did show is that staff didn't feel they needed a lot of training, which showed actually quite a high degree of digital skill, that even though a lot of staff might have been thrown at the deep end initially, although Teams was there, but maybe not everybody had been using it on a daily basis, they did feel confident after a while of learning and seeing how other meetings were being handled or how their colleagues were using it. They felt more confident. So I thought that was very positive. And we are reviewing the policies, as you'll see. We are linking this to the revised Agile Working Policy. We did put an updated Agile Working Policy in place anyway to support people working at home through the pandemic, but we're working on that further. and taking the policies further over the coming year. There is quite a lot of data as well around headcount and the workforce profile in the report, and we've also got some supplemental information on that which might be helpful, which I can email over to you following questions that the working group has raised. Interesting as well, seeing some of the data that's as a result of us recruiting the TTP teams as well. One interesting outcome as well is that staff sickness has reduced. Now, obviously, this has to be taken with a degree of caution because we've got to look at how sickness was being recorded, but also that we're looking at the right things around it. On the face of it, it looks like sickness has reduced. So we're going to do some more analysis, but that was quite an interesting outcome, which you'll see is included in the report. A lot of activity throughout the year on both TTP and volunteering, as you'll see. The staff reacted very, very quickly. People requesting to help, people wanting to volunteer. Those people where their roles were perhaps slightly reduced because of the first wave of lockdown, desperate to help with regard to the sort of food banks and other work that we were doing, which was, you know, really great in terms of how the workforce responded to the crisis. And then finally, just at the end of the report, all the health and safety and corporate wellbeing activities that the council undertook to support the workforce. Because obviously, I think especially in the first wave, everybody was working very long hours. You know, everybody just full throttle supporting the pandemic, trying to support the public and residents and businesses, whatever role they were in, even if it was a back office role, as much as possible. And so the amount of support which the health and safety team were able to put in place to give support, whether it's frontline social workers or whether it's back office, and being able to make sure that people did have enough well-being. We've been trying to encourage people to take leave throughout the year. It's been one thing that CMT has been very keen on, that, you know, we didn't want staff to burn out despite the fact everybody was working so hard, and it was such an unpredictable situation at the start. Very much wanting people then, when it got to the summer, that people were taking leave, getting time off, being able to take time to recover and recharge the batteries, and that continues. And where people haven't been able to take leave, there is obviously we are allowing people to carry forward 20 days. So as long as it's taken the next 2 years, so we, you know, all policies is in line with us trying to sort of support the staff as much as possible. So if it's helpful, I could move on to trying to answer some of the questions that has come through. Would that be helpful, Chair? Okay, so in terms of Councillor Dirk asked for some more mapping information. We have got some of that, and what I'll do is I'll email that separately after the meeting, if that's okay, so that the committee can see that information. Councillor Dirk also asked about trade union engagement. So yeah, I mean, there was trade union meetings were weekly during the pandemic at its height, and then now it's meeting every 2 weeks. All risk assessments were going in front of the trade unions, and any team that was coming back into the office, they had to put a risk assessment in, which trade unions were looking at. Any issues that were raised were addressed at that meeting, and also the Director of Social Services was also attending for the first 20 minutes just to be able to answer direct questions around social services, which I know people were concerned about. And areas that we did consult with, sort of things like PPE or setting up the TTP, any frequently asked questions for staff, you know, things around shielding, those kind of things, annual leave, redeployment, those kind of questions. So we were running those past the trade unions as well. So they were Councillor Dirk's questions. Councillor Jones' questions. So Councillor Jones, you said so it was a novelty for many staff to work from home to begin with. Do we know if staff have found it harder to work from home as time has gone on? So as I said, the survey was very positive. So I think 90% of staff were saying they found working at home good or very good. or neutral, but not worse. And 87% said positively that they liked working from home. Now the plan is to follow this up with another survey. I think what we'll probably do there is, as lockdown has ended, because I think your question probably goes to the heart of it. I think as we've had many lockdowns, I think probably everyone has found it harder as time's gone on. I don't think it's necessarily the working from home per se, but I think it's because people have been confined to the house all the time. I think it's different if you can work from home, but you can go out at the weekend or in the evening, then that's one thing. But if you are working from home, but you're having to stay in at the evenings and weekends, obviously apart from exercise, you know, I think it puts a different slant on that. So I think we will follow it up with another survey, but we're thinking now that restrictions are lifting, it'll be a better time because people will be able to get out more. And then there was another question from Councillor Jones. What is the route for staff to take if they are not getting enough support? So in the survey, 77% of staff did feel that they knew where they could get help. Staff can speak to their line manager, but there's HR, and there's also the psychological first aid support service. If staff want to, refer into that, they can. So there are routes that staff can refer into to get support, but it would usually be their line manager first.
Okay.
Councillor Jardine asked, do staff want to work from home because it makes them happy and suits their lifestyle, or because they are afraid to go out? And that staff should have some face-to-face contact with colleagues and managers, and is this happening? So again, we asked in the survey, after COVID, how often would you like to work from home? And 84% said they'd like to work 2 days or more from home, and 85% said they feel more productive working from home. Now, we know anecdotally that some staff and managers have said they actually feel that everybody's more accessible now using Teams remotely when they were physically in the office. I guess was people were physically in a room, in a meeting, having to travel between offices. There were times in the day when you weren't actually able to get to people and talk to them, whereas Teams has actually brought down those barriers. So anecdotally, and again, this is something that we probably need to explore in the next survey, staff and managers have felt that there's been more access. And again, anecdotally, some staff have said, they found it easier juggling a range of commitments while they're working from home. And I guess we've also seen that with, homeschooling and all sorts of things where staff have had to juggle many things across different hours of the day. But we haven't heard of staff so far being afraid to go out. Obviously, we're making sure that if staff are going into the office, that we've got safe environment. That's been of paramount importance. And we've been, working hard on that. But we haven't heard that staff have been afraid to go out. But I think, again, the follow-up survey, that's something that we'll explore just to see how people are feeling about it. Councillor Anderson, yourself, you asked, do you know how many staff have been fully vaccinated or are waiting for their second vaccination? So we have, obviously, the frontline staff in key areas like education and social services have been offered the vaccine. Staff have, as the same with the public message, everybody's being offered the vaccine in the waves that they're rolling it out.
Can I take you back a step, Sarah? I got feedback for some reason. Going back to Yvonne's question, what's the general feeling on when we come in throughout this lockdown? Now, what is the general feeling of our staff meeting face to face?
Do you mean in terms of anxieties around meeting face to face, or is it a bit that I haven't picked up from?
anxieties face to face, especially with the general public?
Right, yes. Part of the risk assessment we're very much trying to assess what the risk would be and how we can put appropriate measures in place. So, for example, if you're talking like about an area like reception, making sure that we don't have a lot of people in reception or coming into the building at one time, that we're monitoring numbers and occupancy very carefully, and that staff have appropriate equipment, and that we have appropriate social distancing in place between the member of the public and the member of staff. So all that is documented in the risk assessment, and managers are working with teams on that. But it kind of depends on the role, I guess, in terms of, it's not, again, like I said at the beginning, it's not one size fits all. It depends on the role that the individual does. I mean, obviously it's different in social services, but if you're talking about something like reception, also quite a few services have moved as many services as they can online with appropriate telephone and email support to back it up. So even though people might not be able to access everything online, people can still ring in, and they can have facilitated support where somebody in customer services might be able to help somebody fill in a form, or somebody might be able to email and have an email exchange. So there are a range of things we're putting in place so that A, we don't want residents travelling in unnecessarily, but B, putting anybody, either staff or residents, at risk, and trying to adhere to social distancing when things do reopen. And in terms of meetings, again, Jeff might say more, but measuring occupancy quite carefully in the building so that, meetings are booked, who's going to be there, how many numbers, appropriate cleaning, etc. So. Chair, there's a few hands up. Do you want me to take the questions of where we are in terms of the hands that are up now?
Yeah, Jeff Bacon is got his hand up, I see.
Yeah, sorry, that was a follow-up. So Clive was before me, but I just follow up on Sarah's point as she referred to with regards to meetings. Yeah, there is a very clear guidance and procedure when it comes to booking meeting rooms, not least because the instructions still to work from home wherever possible. But if you cannot have that meeting remotely, then yes, of course you can come in the office, but we basically have to make sure that rooms are booked appropriately and the cleaning regimes are in place appropriately as well. So systems are in place to enable face-to-face meetings if needed in a safe environment.
Thanks, Jeff.
Okay.
Joe, you got your hand up?
Yeah, cheers, Chair. Sarah, the Chair raised a very good point about staff anxiety, stress and anxiety, and I'm just wondering whether we employ any psychologists in the wellbeing team, and if we do, would it be possible that we can engage a couple more? Because I would have thought that these cases of anxiety and stress in the workplace aren't few or far between. Yeah.
Sarah, would you like to come back on that question?
Yeah, thanks. I think it's one of the things that we're needing to review, isn't it, as when we come out of the pandemic, looking at, because it has been incredibly invaluable having that frontline team offering support to everyone, and I know the staff found it really helpful. And you see in the report the positive impact it's had. So I think we'd have to take that into the discussion about workforce planning. Absolutely.
Okay.
Yeah. Sorry, Sarah. Do we employ them though? Do we employ psychologists?
Yes, I think we do. I think we do employ. In terms of the technical name, I'd have to come back to you in terms of exactly what the technical name of the role is. But they are in terms. Well, they're not. I suppose they're not psychologists. They're sort of talking therapists. So they're. I think they're BACP qualified. So not psychologists, as it were, but talking therapists, I think. Yes.
Okay, that's interesting. Thanks very much.
Yeah. Jeff, do you want to come back in on that, or?
Yeah, sorry, it was very quickly. In terms of the guidance that we've sent out to all staff and managers, we obviously make it very very clear to managers they've got to be very aware of the potential mental health impacts of COVID, and if they're undertaking it, if they identify any potential issues, then it's referral to occupational health services. It's a stress-related issue. So again, it's just making sure that staff and managers are talking on a regular basis, and we're instilling that in everyone.
Okay, thanks, Jeff.
Thanks.
Clive, least but not last.
Yeah, I won't come in on specifically on that, but I will. I know from from adult social services and child and family that there's an opportunity for something called psychological first aid, Joe, which we've operated via OC Health and corporate services. I don't know the detail of that, but I know that is a service that we've offered to frontline staff, particularly in, as I say, in social care. So that is something along with a wider. I've been working with the Association of British Social Workers about a wider wellbeing and psychological toolkit as well that staff can access, online as and when they need to. That wasn't why I was coming in. Actually, it was about the vaccination. I know Cyril asked about the vaccinations, and whilst I haven't got specific figures around Swansea Council specifically, in terms of social work, adult social care and social care staff, Chair, then they are the main cohort, along with health, that were in the second priority group for vaccination. So and to date, 89% of our health and social care staff have received their first vaccination, and 74% have received their second vaccination. Now, given that education wasn't a priority group, although we did add those that were those in education that worked in special schools and administered intimate care with pupils, they were added into the main cohort of social and healthcare. Given that criteria, they would fall under that. So that, it might not be absolute in terms of Swansea, but they are there or thereabouts. So up to about 74% of our staff would have received their second vaccination to date. And my understanding is that the sort of pushback of staff that may not be inclined to take the vaccination or can't take the vaccination is very small as well. So, I suppose that is good news.
Thanks, Clive. Back to you, Sarah.
Great, thank you. Right. So, Councillor Jones, you asked if staff are carrying out a role that was face-to-face with the public before the pandemic. How is this working now as staff are working from home? And what effect has staff working from home had on the public? Many members of the public are not computer literate. So it goes back to the point I made just before as well. So it is a mixed picture. Some face-to-face roles are still continuing, and we're doing risk assessments around those. But other roles have shifted to telephone and email support, where the public can't get online. There was a huge amount of work as well that went on during the first wave of the pandemic, during lockdown, where the local area coordinators and SCVS and other volunteers, where people knew, especially elderly residents in communities, supporting them directly if they knew they couldn't get online, either helping them through family members or helping them directly so that they could access services. And to be fair, we weren't alone in this. I think, it was very hard in terms of banking, all kinds of things. I think there's a lot of people had to shift to online channels during the first lockdown. And I think some actually found it helpful, because then we know that some residents then were using that as a means to then talk to family and friends through video conferencing software and all kinds of things. So I think that shift for some people was actually helpful. For others that were struggling with it, we've also got the telephone and email support, because we recognise, it's not, not everybody will be able to do that. And volunteers were helping people locally in the community. Now, we know that digital inclusion was already quite high in Swansea. There's always the question about, although people might have access to broadband, what are their skills like? But we know that actually in Swansea it was pretty high. It will have gone higher because of the pandemic, we know that. But for those, I think when we were looking at this in terms of the digital inclusion strategy, it was particularly the over 75s with a disability that was that particularly didn't want to use the internet. And I think it's that group that we've been particularly trying to help. And just to give an example, so for example, with things like a blue badge, you know, people can phone and we will complete the form with them and for them online over the phone. So because obviously that is an all online now, it's not something that, you know, the council has any say in. It is all online. So, but we are able to help facilitate that. And I think it's that model of being able to have, you know, online first if you can, but if you can't, we can support people, even though we've had the lockdown and people haven't been able to come into the building. And to a certain extent, I think coming out of the pandemic, that is helpful. I think it's harder for residents if they're having to then come into the civic offices to get help and support. I think if we can provide that support over the phone, it means they don't necessarily have to go out to do it. So I think that's something that post-pandemic, I'm hoping residents will find incredibly helpful. Okay, and Councillor Hale, you asked, do we have a standalone home working policy? Yes, we do. And when I send the questions back, I'll put a link to it as well in the answers so that you can click on that and have a look at it. And we are reviewing that as well, alongside other relevant policies like the Agile Working policy, and also there's a policy there around IT equipment that I spoke about before. So I'll put the links to all three of those so you can have a look at those. And you also asked, many of those staff who rallied around and continued to work through the pandemic might have been agency staff or outsourced staff. We will be working to bring those staff and services in-house. In terms of, we won't be looking to bring additional staff in-house where it's been a partnership approach. So for example, for TTP, that was ourselves and the health board. Those people will go back to their substantive jobs because people had other jobs but were sort of seconded into TTP, and we supplemented that with staff on fixed term contracts. So if TTP stopped, then those contracts would come to an end. So
I was thinking, sorry Sarah, I was thinking more like the bin men. You know, we got a few agency staff employed historically as refuse collectors, and we were given an email to say how could we reward staff, and I think for those agency staff that never let us down, because we never went without bin collections, I think the greatest reward we can offer them is to give them a contract.
I could take that back to Chris Howell.
Thanks very much.
Okay.
I mean, there's not a huge cost now. Terms and conditions are pretty similar. That they get paid the same wage. They get their holidays now. But I can't really see. It's the moral thing to do. It's the right thing to do. You know. Thanks.
Chair, you're on mute. Sorry.
Yeah, back to you, Sarah.
Chair, Councillor Lewis has got a hand up. Shall I take that question before I move on? Would that be helpful?
Yep.
Yeah, it wasn't a question. It was actually following on from Councillor Susan Jones's question about more staff working from home. And I just wanted to make the point really that members would be aware that since the beginning of lockdown, the district housing offices within housing have been closed. And so we've had to communicate and operate differently with our tenants. And we've seen a huge surge in council tenants accessing services online. And that is something that we wanted to make a push towards in terms of modernising our housing service, but actually the pandemic has accelerated that. You're right to point out that there are still, there's still obviously a percentage of tenants that digital access wouldn't be suitable, and we are serving them and helping them in different ways. As Sarah said, there are telephone lines and numbers, but actually I think it's been a success story, if I'm honest. And we are, and I know Sarah, this is probably one for a different committee or different working group in the future, but we are working on the housing portal and encouraging tenants to access us from home, because not only is that good for them because it limits their journeys that they need to take, it's good for the environment and it's more efficient. So, there's lots of pluses to moving services online, but I do accept the point that you can't do that, 100%. You have to always factor in that small percentage of people that won't suit them. And so we'd be pushing our neighbourhood support officers out into communities when the time is appropriate and it's safe to do so. Thank you, Chair.
Okay, thank you. Back to you, sir.
Okay, thank you. And then Councillor Hale, final question was, what annual leave are staff being allowed to carry over into the next leave year? So there was a government initiative on this, government policy. So staff can carry forward 20 days, but we ask if they'll take it over the next 2 years. So that's their leave years, as it were. And Councillor Tanner asked, I do believe that there will be staff that have welcomed working from home and we want this to continue. Will that be an issue? Will that be up for discussion? And we are looking at all of this as the council is going to operate as we move forward and come out of the pandemic. We were, and as I said at the beginning, we were already rolling out Agile Working and we were 75, 80% on with that. That'll continue to conclusion anyway. But I think it's the further dialogue that we need to have around the wider aspects of this, because it is about, Welsh Government are talking about they'd like a policy of 30% of the Welsh workforce working at or close to home, which brings in discussions around accommodation, community hubs. It brings in the climate change agenda, it brings in customer contact, it brings in all kinds of things. So it's a very wide debate, I think, that it opens up. So yes, definitely, I think there'll be a lot of ongoing dialogue on that one. And that is the end of the questions I've had so far, but happy to take more. Thank you, Chair.
Yeah, Joe, I see your hand up.
Yeah, cheers, Chair. Just a couple of points there, Sarah. What was the position with staff shielding? Were they available to take 20 days over if they hadn't used leave? I know how desperate some of them were, sitting in 4 walls for nearly a year, and then some staff being told, you're going to have to use all your holidays up before the 31st of March. Not in local authority, I'll have to say. This is in another area of public sector where I have an interest.
I mean, for us, we have obviously been encouraging staff to take leave because we didn't want people to be burned out. I mean, even if staff were shielding, they would have been doing other roles for us in the council, and so we were keen that people took holiday. But in terms of, we were very clear, it's same for everyone. Anybody could carry their holidays over to 20 days. So I don't know about the rest of the public sector, but that was the government line. So
yeah,
we've supported that.
Will we get some figures on that, on how many people did take the 20 days or take holidays over? Because that will have an impact moving forward on the workforce, won't it? So that has to be audited. There has to be data on that somewhere.
Yeah, we keep, everything is kept in the Interflex system because people book holidays via that. So yeah, we should be able to get some data out of that.
Brilliant. And the other thing is the Agile Working. I know a big constituent part of Agile Working is hot desking, which I can't, it's not encouraged, is it, at the moment? So I'd be pretty surprised to see that in a policy document.
Sorry, say that again, Joe. Which bit?
The hot desking.
Oh, hot desking.
Whenever you read about agile working, not only is there the flexibility, but there's also hot desking. Every document I've seen on it always mentions hot desking. Now, you only need one person who doesn't follow the rules, and you'll get flu and everything else spreading throughout a department. So I'm just hoping that that's not going to be in the document.
I'll let Jeff. Do you want to pick that one?
Yeah, I think we're almost talking about two different things, aren't we? Really, in terms of future agile policy, that's almost beyond pandemic and whenever that may be. Clearly, during the course of the next few years, I think we're still going to be working within a socially distant environment. Our office layouts have been designed to accommodate that, and the reason we have the systems in place at the moment is to ensure that you don't really have, as you described it, as hot desking for the period, because you need to make sure that those all the desks and workstations are properly cleaned and only occupied by one person during the course of that day. So we have in place a shift system in terms of booking those desks. And even if you're coming in just for half a day, then if you come in for half a day, then that desk is basically booked out for the day. When it comes to future agile working policy and accommodation strategy, we need to understand how things are going to settle and how things are going to be for the next few years. But for the moment, the agile policy, as we describe it, is really more to do with the actual the ability for staff to be trusted and empowered and have the choice of working from home for their focus work. And we fully expect that working in the office will be more to do with the collaborative space and collaborative workings when you need to engage with your team members. And I think that's the way that we're going to have to see things are going to develop over the next few years. Once we have the instruction away from work from home wherever possible, once that changes, then we'll be liaising with managers in terms of how they think it's going to work.
I think cheers, Jeff. But I think
Okay.
a few of us, even a few years ago, were saying that this open plan office strategy was really backward thinking, and some of us did challenge it by the very fact that the old saying, coughs and sneezes spread diseases. And
Yeah.
there was always a very good reason why people were spread about, why people had their own desk, why people didn't hot desk. But it seems like because it was the perceived way forward, that everybody had to jump on board. But when you delved a little bit deeper, there was some very good papers and articles, even from America, that were saying this is a backward step. And we shouldn't be doing this because it will spread disease. It will spread infections. But of course, because sometimes we're driven by other things, that did seem to be the norm. And I'm not saying pandemic summons the favour, but I think in certainly in this area, maybe there has to be more thought gone into how we do deal with staff that are coming into the workplace.
Sure. I think to be fair, we have the systems in place we've had now. I think will follow us through, won't they? We're undoubtedly looking at a change in the way the office environment is going to be. There'll still be an office environment. A lot of people are clamoring to get back into the office, but as Sarah pointed out from the staff survey, when we go out for a refresh on that, I fully expect it's probably going to say the same sort of things. Where people want the flexibility and the choice of working from home 1, 2, or 3 days a week. But we'll have to come up with an office environment that, you are right, has to be safe and applicable. And we're learning from everything all over the world really at the moment in terms of what's happened, but what we got in place at the moment has stood us in good stead, I think.
And good ventilation.
And good, and fresh air.
Yeah.
Thanks very much. Cheers. Jeff.
Okay. Thanks, Jeff. Les, got your hand up?
Yeah, thanks, Chair. I just wanted to double check something that Sarah said about where staff can go to if they feel the need to get mental health support. And I might have misheard you. Did you say that their first port of call would necessarily be their line manager? And the reason I'm asking is if that's the case, and I might have misheard you, I just think that there are going to be some people who have got good reasons for their own reasons because of their own circumstances that they wouldn't necessarily want to go to their line manager as their first choice. But as I say, I might have misheard. Thanks.
Sarah, you come back on that?
Yes, I mean, and invariably, obviously, we would ask them in the first instance to go to their line manager, but because that, you know, that's the person that we would hope most staff would have the relationship with. If they feel they can't, as you say, then there is the other two ports of call that they've got, so they can go to HR, and they can also go to the psychological first aid service as well. So obviously that we set up. So they can go direct. You know, we did, you know, if you say in the report, but it used to be, you know, what was the Helping Hands service that was sort of subsumed into that. We have the volunteers that that people know and can go to, and there's a lot of information on StaffNet so that people can access support from other areas. We try and put a lot of FAQs on there as well. So ideally, yes, the line manager, because we would hope that they could, but if they can't, yes, then we would hope that it could be either HR or the psychological first aid service.
Okay, thanks. And I think just to say, I don't think it's because they wouldn't necessarily, hopefully they do get on with their line manager, but sometimes if it's something like mental health, it's a different thing altogether, and some staff would not necessarily relate it directly to their work issue. They would have something that maybe they would want to keep it private from all their fellow staff, and that would include their line manager. That's why I was just making sure that they'd got alternatives to go to. All right, thank you.
Yeah, and I think part of it as well is, you know, and we know this from looking at, you know, long-term stress figures where people are off sick with stress. You know, it won't necessarily be about work, it'll be things happening at home. And I think the thing that the line manager can do is the appropriate referral into different services. And sometimes if we have to pay for services and things like that, I think that's why the advantage of the line manager, because they might be able to do a more intense referral if needed. But I accept your point, absolutely. But there are these different avenues for staff so that we can hope we can give everybody the best support is what we're trying to do.
Thanks. Cher, you got your hand up?
Hi, thanks, Chair. It's just picking up on what Sarah was saying about burnout, and coincidentally, something that Joe Hale said as well, in as much when you're looking at open plan working, a lot of the staff that we have now are working in an open plan situation because they're working from home, and the modern sort of homes are generally an open plan home. So not only are they just working open plan, but of course there are a number of family members within that. So when we're talking about burnout with the stresses of the additional people in the home, the homeschooling, and you know, how is that being managed by supervisors? Because I do get concerned when I see emails coming through at perhaps 8, 9, 10, 11 o'clock at night sometimes. And I just think that that's actually taking flexibility way too far, where people have had to look after, because obviously we've all isolated. So you've got your duties in the day, but then you're carrying your work on into the night. And I do have huge concerns of that. And also how the home is actually then being used and considered that it's a workplace then and not a home. And with all of the, you did mention right at the beginning, Sarah, about, you know, things like adaptations for, you know, chairs, etc., etc. But of course, those have to be incorporated into a normal house, and sometimes there isn't the space for that. So that was one part of it. And then when we're looking at the survey that was done, how would you and how will you encourage those people who didn't fill in the survey to fill in the next survey? And are they anonymous? I'm sure they are. It's just I didn't pick up on that, because obviously sometimes that can cause people to maybe put an answer in that they think they should be writing and not perhaps an honest answer. And I think that's what we're looking for really to be able to take things forward, is that honest and really full appraisal of the situation, not just by those people who want to work from home. Because I always wonder then, For the people who didn't complete the survey are those the ones who didn't want to work from home. So you'll always get those that were very happy to put something in. Sorry, I didn't want that to sound as confusing as what it was, but it is the time management situation of, making sure that people don't burn out on that daily basis as well. Thanks.
If I could answer the second part of the question first, because Jeff, I know Jeff has to go as well. So if you could help with that, in terms of the I can't speak now. Anonymity. I can't speak again, of the survey. Thanks, Jeff.
No, but yeah, it certainly was anonymous, and I think one thing I would say, as Sarah pointed out at the very start, I mean, the level of response we had was exceptional compared to our normal staff surveys. And the thing that was also very comforting was the fact, the positivity around the home working, and the fact that most people were comfortable, or they felt they felt happy, or they felt very productive, was very much in line with what was happening across the country. So every national result and every national survey I saw said very much the same thing. And what tends to happen is those who are happy with the situation tend not to respond to a staff survey. It's the ones who basically tend to have a problem, especially when it's anonymous, who tend to respond and raise their concerns. So we'll see what the results are when it comes to a refresh of that, which I think is going to be around sort of May time, where we just wanted to get a bit of a temperature check as to see how people really are after another year of working at home. The key thing is that this is the choice. No, sorry, it isn't a choice now, but it will be a choice going forward in terms of any future agile policy. We won't be forcing anyone to work from home if it doesn't suit their purposes, and everyone's circumstances are different. What we've tried to do is to make sure that we're supportive when it comes to furniture, but not everyone wants an office chair in their house. Not everyone's got the ability to have an office chair in their house. We've supported when it comes to reimbursing costs of IT equipment if they needed IT equipment at differing levels depending on their work styles and their type of their work activity. So we've done all we can really to support, but I suppose the key message is this isn't something we are going to say, right, fine, we're in this world now, this is the way it's going to be. If you can't work in that environment, then you shouldn't work in that environment. And even now, if you're struggling to work at home, you can come into the office because you can't reasonably work from home. And that could be whether it's because of your work activities or the fact that you are struggling full stop, whether it be from your own mental health and well-being isn't as it should be. You can still come into the office. The only thing I would say is there's so few that are in the office, you're not getting that sort of emotional support, if you like, from your colleagues, because there's very few people in the office full stop, which perhaps tells its own story, the fact that most people are relatively comfortable with it. But we'll get further response when we have the staff survey going out, I say hopefully sort of May time. And we hope we have the same level of response, but certainly it was the best responded survey we've ever had, I think, to be fair.
Is that okay, Shep, on that?
Just to add on that, sorry, I just wanted to say the plan is not to, as Jeff said, it's not to force people to work from home. It's flexible working wherever people want to work. So actually you can work from a range of locations, one of which is at home. And I think that's the thing, it's about choice. We're not saying, right, you're suddenly working at home. I think it's about having that choice of, you might have another building which we have, which is closer to where you live. And there's no reason why people can't go there to work if we can make the accommodation work. So I think that's why the whole dialogue is quite broad. It depends on whether you're in a customer contact role. It depends on whether you can work from home or you want to. It depends what the accommodation strategy might look like. I think we've got to look at it in the round and have quite a wide debate about it.
Mm-hmm.
Thanks, sir.
Chair, and the protection against the daily burnout, the emails late at night.
Yeah. Okay. So we've done quite a bit of work with leadership team on this as well. We've talked about this a lot at CMT. What we've tried to do, and because it's been sort of forced lockdown, we've encouraged managers to be very flexible with regard to hours. So I'm hoping that if you are seeing emails at 10 o'clock at night, that's by choice. So people might have just completely shifted their hours. So they've said, actually, I want to do these other things during the day and do, supporting children with home working or homeschooling or whatever it is, and then picking up work at different hours. or picking up work around those other duties. So I think, or other commitments. And we've been as flexible as we possibly can. Managers have been, with staff planning their day how they would like to. And I think, yes, I mean, I think, hopefully people aren't sending emails at very unreasonable hours. And if you have examples, then, we need to know about those. But I think generally speaking, managers have tried to manage that appropriately alongside encouraging people to take holiday as well, so that, people, I suppose it's the other stress, isn't it, where if people don't feel they are in control of work and home duties, then that in itself can be stressful. So sometimes people find it more stressful if they haven't been able to do the work. And I suppose it's just managing all that within reasonable hours of the day. As you said, we've done a lot of work with leadership team, with managers, to encourage them to manage their staff's days. But if you know of examples then that you're unhappy with, let us know and we'll have a look at it. But generally speaking, we've been quite confident at how managers have managed that.
Okay. Clive, you got your hand up?
Yeah, I was just touching on something that Cheryl raised, and listen, I think the other thing that about home working and the way we work in the future is going to be job specific as well. I know we're talking from a whole workforce perspective here, but I'm assuming I've been invited to talk about social services, and one of the difficulties from a social services perspective is that just by the nature of some of the issues that we deal with is reliant on a team environment. So social workers, for example, and Jeff has mentioned the common access point, and that's one of the things that we try to facilitate, where we can still have people in an office environment due to the pandemic as safely as possible, is because individually, it's not something that can always be resolved. People need to help people by taking a triage approach of different bits of advice from different experts in that front end environment. That's one aspect. But I know that certainly from a social worker perspective, Sarah alluded to the fact that we were able to set up home working quite quickly, and that's been really good. But I think there is a tipping point for certainly some of our social workers who need that sort of team environment to be able to deal with some of the very, very complex issues that they're being asked to deal with. So it's from a social care perspective, it's about being job specific, and maybe not a situation where people may want to work from home, but that's not the best solution to how we're trying to provide a service to some of our most vulnerable residents. So I think that's one of the learning and one of the issues that we're going to have to build in to any future plan going forward, because it will have an impact on individuals, and it will have an impact on burnout if there's too much pressure on certain individuals with that ability to bounce off their team members.
Thanks, Clive. Back to you now, sir. Back to the report.
Thank you. Was there any other questions I can take, or?
Has members got any further questions? No. No, sir.
Thank you very much.
Oh, 1 second. Susan Jones, sorry, you're on mute, Sue.
Thank you. Sorry. What Clive just said is what I was trying to get at with my question. It's the informal support of a team around people is quite, well, it is supportive if you're in a team within, as I say, social services. Out in my questions. So thank you, Clive.
Okay. Andrea?
Yeah, if I can just come in very briefly as well. I think this isn't limited to just social services. I think, there is a need for team support. And going back to Sarah's introduction at the very beginning of her taking us through the report, She said this won't be a one size fits all. And I think that's what, that's the direction that we are heading in. It's going to be a mixed blended approach. It's likely that we will see some days working from home, some days working in the office. And I think it isn't going to be the same as it was pre-pandemic, but it will be a blended approach of what we've seen throughout the pandemic and prior to it. So, I think it is important. Team support is important across the authority. Lots of people are missing those water cooler conversations and those corridor catch-ups that you don't see, between teams, not within your own team, but outside of that as well. And I think we're seeing that as counsellors, we miss contact with each other. So I think you're going to see a blended approach. You'll never get rid of the office environment. It'll always be needed. But I think we can work smarter as well. So, I hope that clarifies that that's what we'll be aiming for moving forward.
Thanks, Andrea. Sarah, any more on the report?
No, thank you. Thanks. That was really helpful.
That was good. Okay. Before we go on to this item agenda 6, discussion and conclusions, I would like to thank, I know it hasn't been easy for all our staff working from home, especially with looking after children and things like that, especially over the last 12 months as well. But I would like to thank the officers who have put this report together. I think it's answered all our questions. If we have got questions, we'll send them to you in a letter. And if you've got no other questions or any information, we'll go into agenda item 6, and I'll release the officers and the cabinet members to
Thank you, Chair.
have an early day.
Thank you, everybody.
Thanks.
Thanks.
Thank you, Chair. Thank you, members.
Bye.
Thanks, bye.
There we are. I think it's just off members now. It's agenda item 6 is discussion and conclusions. So what I'd like to see, what do we want to say about this issue to the cabinet members in the convener's letter, and what are your conclusions arising from the session? Anything, boys and girls? I see Leslie.
Right. This comment is not for what to put in the letter, but it's just an observation that if there's going to be another survey, which makes total sense, I would strongly recommend that we come back to this again after we find out the results of that survey and look back and analyse what the difference is between now and what might have happened by then. Thanks.
Okay. Chris?
Thanks, Chair. I think Leslie said a bit of what I was going to say, but I was going to put a time scale on it. I think the important thing is that what we've heard today is not that we are going to have a system with a workforce which is going to be more flexible and more understanding of people's way of life more than anything else, and work-life balance. As a result of that, I think what she's saying about coming back with the results of the survey, I think we need to wait as at least 6 months to understand what the future is holding for us and our workforce. I think one of the other things that obviously has come out of that is where the workplace will be. And I think that's another issue that with time we'll only tell on that. Excuse me, because of the way in which the workforce pattern will change, where they're going to be working, etc. So I think whilst we would like to come. I think we need to reconvene when the survey's done, but I think there needs to be a bit of time between now and then, Cyril, Chair. Excuse me. And I think that we need that time, and the workforce need that time to establish if there is going to be a new norm, what that new norm will be. Thank you.
Yeah, I totally agree with you, Chris.
Can
My way of thinking is bad coffee.
So
Go
just quickly come back. I totally agree with what Chris says. We need to wait. What my point was simply, let's get the survey over and done, and that could take a few months before the results come out anyway. Thanks.
Yeah, I agree with the both of you. We need to wait now, sit this out, wait for the reports to come back, because it's obvious we're going to have to go back and reconvene again. So yeah, I agree with you, Chris. It'll take about 5-6 months. Mary?
Thank you, Chair. It's just some points I think that Joe raised, and I'm sure Liz has got them down. It was asking about the agency workers, and we wanted to have some reassurance if we could incorporate them into the workforce. I think that does need to go into the letter. But also, I think Sarah actually referred to it, and Jeff, when we were asking about the help, the mental health help, and we didn't actually have the correct definition or whatever of the stuff that people, staff can access. And I think we need to understand, she said line manager, but it was also what happens after that and how many people have actually had to go on further that it's affected them. Because I don't think the survey will pick that up. I think we need some figures around if there is sick leave for that reason, or if people have felt that they have been helped, I suppose, but the service that they access to get the help. I hope that makes sense to you. Somebody will understand what I'm trying to say, I'm sure.
I'm sure Liz will understand. Sue?
Thank you. I agree with what Chris and Leslie said about coming back to this in a few months' time. I think that's really important to have a comparison. But I don't want this in the letter, but just a comment. We talk about the phone being available for the general public. Well, the robot on the phone doesn't understand my accent. So can we upgrade the phone system?
That's a good point, isn't it? Yeah. I've got to ask it twice or 3 times before it understands me.
It's crazy.
Yeah. Electronics.
I'm screaming at it sometimes.
Okay. Is there any more questions that we want to and more discussion?
Yes, Chair, if you don't mind. It's going back to the telephone thing. It's also the people available on the phone, because there have been issues where they've been ringing the number and the people aren't available. I mean, they're supposed to switch over, I think, to mobiles that they've got. So there does seem to have been some issues with, you don't have to have your mobile. You might have had a letter from the council with a proper extension number on, but unfortunately it doesn't go any further. So I think we'd like some reassurance that if we're going to have this blended approach, that for the people that do have IT issues, as I said, 75 plus with disabilities, we really need to make sure that we are looking after them, because there's no good saying, oh, you've got to buy a computer. They don't want to buy a computer. They can't use the phone. They only use it for telephone calls. They don't do emails on their phones like we do. So we really must remember that anybody that's not computer literate is given the help, and the phones are answered, or they switch through to somebody that does answer it.
Absolutely. Thank you, Mary.
On that point, Mary, I was in a meeting with Sarah Lackenby last week, and I did actually send her the email with those concerns that people are ringing the office, but sadly, the officer is at home. So she is looking into that. But I would like to make a point in the letter of that, because I think it is a good thing, because not everybody is computer literate.
No, we had the problem with the census. People were contacting us because they couldn't get through on the telephone number on the census because they were probably inundated. So it's again about capacity as well. And you know, we're talking about the vulnerable people that are the most vulnerable then, that are actually trying to access our services, you know, not through it. And she said something about blue badge. I have to say, I did have complaints about that. You can't upload the photograph. It's very, very difficult. And yet when you do your bus pass, they take it off your passport if you've got one. I can't understand why we can't do that for the blue badge. So just a couple of points has happened over the last couple of weeks.
Yeah, great.
I think Liz will take that down as a note as well. Have we got any recommendations for the Cabinet member arising from this session? And are there any other issues that you wish to highlight to the Scrutiny Programme Committee arising from this session?
Can I ask, Andrew Stevens wasn't here today, and I didn't share his apologies, but surely he's the Cabinet member for these services and for the IT. So can we make sure that the letter does actually go to him? Because I think it was very good of Andrew and Clive to come along, but really I think Andrew was the one that should have been here.
Yeah, for technology side of it, I agree, Mary. So we'll emphasise that in the letter to him as well. Chris, you want to come back, mate?
Yeah. Can I say one of the recommendations is that that the time scale for us meeting again is put in. The reason being is I don't want this lost. And if we put it in a letter, then it's recorded somewhere that, you know, I don't care if it's 4 months or 6 months, but I think if you put it in a letter, then you're actually recording when you want to reconvene with the results of the survey, so that we, as you rightly said, we have a comparison to what's going on. The other thing I would put in, if I was you, is that we as a group recommend that the personal care of people be part and parcel of home working.
Totally agree. Totally agree with that. Well, I take it that the members and myself, obviously, anyway, we would want to reconvene in, I think the general populace buyer is saying 6 months to give the officers time and our staff, especially coming out of COVID. Well, we're not going to come out of COVID for at least another 2 years. But, you know, it's to see how things develop in the next 6 months. And if we can take things back to them then.
Yeah, didn't they say the survey would be done in about May time?
Yeah, so that's only 2 or 3 months away, isn't it?
Yeah.
Yeah. Cher? You're on mute, love.
Yeah, only just a suggestion that I know that we've had various council meetings and other meetings where we have said the staff need to be thanked. But as this is a scrutiny committee and we're looking at the staff welfare, I do really think that within the body of the letter, we need to signify the huge thanks that we do have to the staff who have been able and willingly volunteering to do roles outside of their substantive role, and the hard work that they have put in and the way that they have kept going. I'm sure there are people there with much better words than me, Liz.
Yes.
You get the gist. I just think because it's a scrutiny committee, we should be acknowledging the hard work and commitment of the staff and of the senior management team to be able to take things through as well. So basically, from everybody throughout the organisation who've worked really so hard.
Right down to the bin men.
Especially
the bin men.
The bin men, you know.
Especially them.
Well,
yeah.
And the ones who don't normally have that sort of thanks, because we just take them so much for granted. But everybody, really, there are so many different areas within the council that we don't come across on a day-to-day basis, but they've still been doing their job and supporting people of Swansea. So just a few words of encouragement, really, and thanks.
Okay. Well, that is it. Thank you for being gentle with me, everybody.
Chair, sorry,
yes,
before
oh,
we
sorry.
finish, sorry. Can I just say, the recommendation about the working group meeting again,
Yeah.
just to clarify, that's a recommendation to the Scrutiny Programme Committee, because they are the ones who decide what the working group plan is going to be going forward. So what I put in the letter is just to say that you'd like to reconvene again. And that's something that we're requesting, and then that's for them to decide. Is that okay?
Yeah.
Liz, can I be helpful? What I was suggesting was that in the letter, we do put the fact that we want to meet again within a set period of time, say 6 months, but we report back to the programme committee that the recommendation from here is that we meet again to assess what the surveys are saying. There's two different things, really.
Yeah. Yeah, great.
Okay.
Is that okay, Liz?
Yeah.
Yeah, good.
Yeah.
Okay. If there's nothing else, Liz, for the members?
No, that's fine. I'll draft something now, and I'll get it round to everyone for you to come back with your comments.
Okay.
Thanks very much.
Okay.
Thank you, everybody, for being, like I said, gentle and